Hello and welcome back to Read the Explorer, Life and Learning Hub. On this channel, I share educational content that empowers individuals, especially women and girls, to better understand their health, well-being, and everyday life challenges. From body awareness to community learning, we cover essential topics that are often overlooked or misunderstood. Today, we're exploring a subject that deserves honest, clear information: genital herpes. Whether you've heard of it, are living with it, or simply want to be more informed, this video will walk you through what genital herpes is, how it spreads, the symptoms, treatment options, and how to manage it confidently and compassionately. Let's get started. Section 1. What is genital herpes? Genital herpes is a sexually transmitted infection, often shortened to STI, caused by a virus called herpes simplex virus, or HSV. There are two main types. HSV-1, which commonly causes oral herpes, those cold sores around the lips. HSV-2, which more often causes genital herpes. However, both types can cause infection in either location. That means HSV-1 can sometimes cause genital herpes, and HSV-2 can occasionally cause oral sores. The infection can affect the genitals, buttocks, anal area, mouth, and even other parts of the body in rare cases. Section 2. How herpes is transmitted. Genital herpes is transmitted through close personal contact, primarily during vaginal sex, anal sex, oral sex. The virus enters the body through tiny breaks in the skin or through the moist tissue lining the genitals, mouth, or rectum. Once inside the body, the virus infects skin cells and causes inflammation, leading to the development of painful sores or blisters. But herpes doesn't stop there. After the initial infection, some of the virus travels along nerve pathways to settle near the spinal cord, where it becomes dormant. This is known as the latent stage. The virus can stay inactive for weeks, months, or even years before becoming active again. When reactivated, it travels back down the nerves to the skin, causing a new outbreak. Section 3. Triggers and recurrences. Many people experience recurring outbreaks, especially in the first year after infection. Certain triggers can reactivate the virus, such as stress, illness, fatigue, sun exposure, menstrual periods. When reactivated, the virus causes similar sores to the initial infection. However, recurrences tend to be milder and shorter in duration. Section 4. Risk factors for infection. Anyone who is sexually active can contract genital herpes, but some groups are at higher risk. These include people with multiple sexual partners, those who have sex without condoms or dental dams, people with a partner who has herpes, individuals with a weakened immune system, such as those living with HIV, women who are biologically more likely to contract herpes during vaginal sex due to thinner and more delicate genital tissue. The more partners a person has, the higher the likelihood of exposure. And because herpes can be transmitted even when there are no visible sores, many people become infected without knowing their partner was carrying the virus. Section 5. Symptoms of genital herpes. Some people experience no symptoms at all, especially during the early or latent stages. Others may not recognize the symptoms as herpes. When symptoms do appear, they can include: in women, painful blisters or sores on the vulva, vagina, cervix, anus, thighs, or buttocks; pain during urination; flu-like symptoms, fatigue, fever, or swollen glands; itching or tingling in the genital area before a sore appears. In men, blisters or sores on the penis, scrotum, anus, thighs, or buttocks; painful urination; general malaise or flu-like symptoms. In both genders, sores may also appear on lips, tongue, or gums, eyes, fingers. In rare cases, the virus can spread to other organs, especially in people with weakened immune systems. It may affect the brain, spinal cord, eyes, esophagus, lungs, or liver. Section 6. Herpes and pregnancy. Pregnant women with genital herpes need to be monitored carefully. If a woman contracts herpes for the first time during pregnancy or has an outbreak close to delivery, there is a risk of passing the virus to the baby during childbirth. This is known as neonatal herpes, a serious but rare condition. To minimize risks, healthcare providers may recommend antiviral medication during the final weeks of pregnancy, perform a cesarean delivery if active sores are present at the time of labor. Section 7. Diagnosis. If you suspect you have genital herpes, see a healthcare provider. Diagnosis is typically based on visual inspection of sores, a swab sample from an active blister, blood tests to detect herpes antibodies. Even if you're not currently showing symptoms, testing can help determine if you've been exposed. Section 8. Treatment options. There is no cure for herpes, but the condition can be managed effectively with antiviral medications. These help reduce the length and severity of outbreaks, prevent future outbreaks, lower the risk of passing herpes to a partner. Episodic therapy. If you only have a few outbreaks each year, your provider may prescribe antivirals like acyclovir or valacyclovir during each outbreak. Suppressive therapy. If outbreaks are frequent, or if you're sexually active, you may take a daily dose of antiviral medication. This approach prevents outbreaks, shortens their duration, reduces transmission risk to others. Section 9. Preventing transmission. Even when symptoms are absent, herpes can still spread. That's why prevention strategies matter. Here are key ways to reduce the risk. Use latex condoms or dental dams during sexual activity. Take daily antiviral medication if diagnosed. Avoid sex during active outbreaks. Inform sexual partners about your status. While condoms reduce risk, they don't provide complete protection, as herpes can affect skin not covered by the condom. Section 10. Living with genital herpes. A herpes diagnosis can feel overwhelming, but with the right knowledge and care, people with genital herpes can live healthy, fulfilling lives. Here's what to remember. Herpes is common. Millions of people have it, and most lead normal lives. The virus does not affect fertility. It's manageable with medication, lifestyle adjustments, and honest communication. Support is available. Don't hesitate to talk to a healthcare provider, counselor, or support group. Section 11. Recap. Let's quickly recap what we've covered. Genital herpes is caused by HSV1 or HSV2 and spreads through intimate contact. The virus enters the body, causes sores, and can become dormant in the nerves. Outbreaks can recur due to triggers like stress or illness. Symptoms range from visible sores to flu-like signs or no symptoms at all. There is no cure, but antiviral treatment helps manage the condition. Safe sex practices and medication reduce the risk of transmission. A herpes diagnosis is manageable, and support is available. Conclusion. Genital herpes is more common than many people realize, and less frightening than it's often made out to be. It's important to stay informed, practice safe sex, and seek medical advice if you have concerns. If you have questions about your health or symptoms, talk to a healthcare provider. Education and open dialogue are powerful tools in reducing stigma and protecting health. If you found this video helpful, please like, share, and subscribe to Re the Explorer, Life and Learning Hub. This channel is all about making health education accessible, relatable, and empowering, especially for women, girls, and the communities around them. You'll find more videos on topics like reproductive health, body literacy, mental well-being, and self-care, so stick around. Also, check the video description for helpful links and a special discount code for Pictory AI, the tool I use to turn these educational scripts into engaging videos. Thank you for watching. Stay curious, stay informed, and stay kind to yourself and others. Disclaimer. This video is for educational purposes only and does not replace professional medical advice. Always consult a healthcare provider for diagnosis or treatment of any skin condition.